Good evening. Let me just get my stuff set up here. Takes a little bit of time. There we go. All right. Good evening. All right, guys. How you all doing on this Friday night? Hope you guys having a good night. Let me see if I get anybody on here. All right. Yep. Bobby Ford. What's up, buddy? It's late up there, man. Go get some sleep. Anyway, what's up? What's up, everybody? I can see some of the comments. All right, guys. Darson, what's up? Maynard, what's up, big dog? SummerSlam on Sunday, buddy. Give me a buzz. Give me a buzz. All right. And I get my sip. As you can see, I'm solo tonight. Charlie is working again. Poor guy. I don't know. He probably regrets getting a real job. So our heart is with him. He's here in spirit. He might be popping on, actually. I'm not sure. But we got Dr. Miscovich tonight. He's going to be coming on in a few minutes, hopefully. Hope this thing works. We're having some problems with um, Zoom, so we went back to our other streaming software, and so anyway, I hope you guys can hear me, and I hope you guys can see me. What a day! No Charlie tonight, Jane. He is working again. Poor guy. He was at the airport at 4:30 this morning. They got some things going on over there that he had to tend to. So yeah, he's excused absence tonight. He's excused absence. Holiday, statehood day, admissions day. But anyway, we got Dr. Miscovich going to come on and talk about what's happening today. I guess it's kind of a disappointing day again. My wife and daughter are doing super, Michelle. Thanks for asking. I just spoke to them today. My daughter was officially released from quarantine by the doctors this morning, so she is doing extremely well. And actually, we're going to have her on tomorrow. I'm going to do a special show tomorrow night, and I'll talk about it a little later when we get more people on. But we're going to do a special show tomorrow night with my son and my daughter. I talked about this a while back. She was too weak to do it, so we're going to have my son and my daughter on. Two of my children early on were against getting the vaccine. They just were not, that generation. You guys all know them. You got kids and grandkids in that generation that do not believe in the vaccine, or didn't think it was real, or whatever the case was. And I don't want to. I don't. Oh, there's Patsy. Patsy's watching. How you doing, Patsy? All the way from Oregon. Love you. But anyway, she's gonna come on tomorrow night to first of all thank all of you for your prayers. We believe in God. We believe in the power of prayer, as you can tell. So she will be on tomorrow night to first of all thank each and every one of you that prayed so hard, and I cannot wait for that. But we're gonna go on tomorrow night at 6 o'clock instead. 6 o'clock because of the time difference. Want to get some rest. But my son will tell his story and what led him to get vaccinated eventually, and my daughter will tell her story. Obviously, she was not vaccinated and she got hit pretty good with this COVID virus. So we're gonna let her tell her story tomorrow, and I'm bringing them on is because you may have kids or grandkids, or maybe even some of you that are hesitant on the fence. I mean, we got people that I don't care what, they will not take the vaccine. And like I've always said, we love them and we respect them. But I think when you hear stories from people that maybe had shared your perspective at one point and then changed their mind because of the virus, uh, I think hopefully anyway, it'll give you guys a little bit more information. So, yeah, Gladys, thank you. I'm so excited that they went out today in the vehicle, went and got their donuts or cupcakes, I guess, and coffee. And she's doing extremely well, praise God. And so she'll be on tomorrow night. So for those of you that have children, grandchildren, please, 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 I'll post up the promo slide later tonight. Have them watch, and you know, I don't know what they're gonna say, but it'll be impromptu, sort of. I'm gonna let them tell their story, and hopefully they can connect with some of our people that are on the fence. So again, I hope you guys can get them to watch. I promise it'll be entertaining. I promise it will be entertaining. So, uh, what happened? No coffee, no caffeine. Oh, well, sorry. No coffee tonight. I gotta sleep. But anyway, so Dr. Miscovich will be on to talk about the staggering numbers again today. Four more deaths on Oahu, 800 plus cases. Today, unfortunately, if for those of you that don't know, Kauai had their fifth fatality, fifth here on Kauai today. Prayers go out to the families. That's I think sometimes I see some heartless comments about COVID and me. I think about the families. I think about the children, grandchildren. I think about the brothers, sisters, moms, and dads that get affected. It's not it's not just four people died. We've got desensitized on the numbers of deaths. Uh, and to be honest, today we got to hear from, of course, the lieutenant governor because he gets his daily time on TV. We got to hear from Mayor Roth. We got to hear from Mayor Victorino. We got a chance to hear from Senator DeCoit and Mayor Kawakami was on the KITV news tonight. Oh, and there he is. There he is. Boom. There he is.
Hey.
What's up, Doc? And you came in right at the right time. I was just telling the viewers that today, of course, we got to hear from the lieutenant governor. We got to hear from Mayor Roth. I think yesterday we got to hear from Senator DeCoit. We got to hear from Mayor Victorino. We got a chance to hear from Mayor Kawakami tonight. It is clear, Doc, and for those of you that don't know, this is Dr. Scott Miscovich, Premier Medical Group, COVID expert, testing expert. He's this is the kind of people you got to listen to, guys. The hell with the University of Google. This is the kind of people that our state should be listening to. But anyway, you guys all know that already. But by listening to all what I heard today and last night or whenever it was, I kind of lost track of time. But it is very clear to me, Doc, and correct me if I'm wrong. It is very clear that the direction of this state and the counties now, it seems, is really to ride this out. That in fact there will be no more restrictions. I mean, I guess Blangiardi stopped the UH people from having fans at their next football game, and people get so pissed off about that. It's like, wow, everybody's irritated because they cannot go watch a football game, and yet four people died today. Four people died. Well, five people died today. We had our fifth on Kauai. Four yesterday. You know what? 1,600 cases over 2 days, and we're worried about going to a football game. Something is not clicking, but it's clear, Doc, and again, correct me if I'm wrong, it's clear that this state is not in a position or has no motivation or desire to stop the current surge, that they're going to ride it out. And as the lieutenant governor said, some people are going to find out the hard way about COVID. That was his exact words, and I was kind of flabbergasted, but that's kind of where it's at, my friend. Let me get us
Um, I'm beyond frustrated. I told you when I talked to you earlier, I woke up with this helpless feeling today, and the helplessness has gone. And I'm not a helpless guy. I'm a guy that runs through walls or finds a way to jump over or crawl under. I mean, if I see a problem, I tackle it. And that turned into disbelief. Then it turned into just, I have to say, anger. I try to keep calm, but it turned into anger. And and then the Queen's West announcement came out. I mean, I just re-listened to the press conference. I'm not sure if everybody did. If you didn't, go online and listen to the news. They all have it taped and it's on there. And just comprehend what is happening. I think it's our second largest hospital on Oahu that serves a main area of our population, had to shut down, had to declare an emergency. They had so many COVID patients coming in, their emergency room is full. They had to call in emergency help from Haima. They had to have emergency tents with bunks put up on their lawn. Okay, this is 2021. And we're sitting here and on your show and all the shows and all my emails and the Tim Browns and the experts that we've had and doc that you've had on this show, we've all been saying a month to 6 weeks ago when this started, this is coming. It's easy to predict because of the data, and as you've said aptly, the last 2 or 3 nights, you just look across the world, we can see the projection coming across. We know what's going to happen. And we just had our second largest hospital just shut down, and we have tents. Now, think about this, Mel. Have you heard a peep from the governor? Oh, sorry. Wait, it's a holiday. I forgot. It's a holiday. Did he say anything
Not
today?
not today, but yesterday he made sure to come on and wish everybody a good holiday weekend, 3 day weekend, and also to remind people to be safe. And we talked about this last night that nurses, nurse, we got Dr. Misko when his dogs go off, man. I think he's a fan of the governors. When you start talking about the governor, they go off. But you know, I talked about this last night that nurses don't have 3 day weekends, and the only people who really have 3 day weekends are state and county workers, of which I am one. But I think that's kind of insulting to go out and tell everybody, "Hey, enjoy your 3 day weekend, be safe." When probably thousands of hospital employees across the state are, I'm hearing now, some of them are actually leaving. They're walking out. They just cannot take it no more, and I don't blame them. I don't blame them. And it's sad. It's what happens when they leave. What happens when the hospital system gets crippled, which they're very close to right now. That's the fear.
Yeah, I'm waiting for something like Lee Cataluna to do a spoof or something and the title will be "Let Them Eat Musubi," where the governor will be sitting there looking up over his balcony, and someone will be knocking on his door and saying, "Governor, the people are dying. They need to know." And he goes, "Well, do we have any spare musubi? Why don't we let them eat musubi?" I mean, what more of an emergency do we need? There is a crisis now. There is nothing that this order to say 10 people or 50 people, it's not going to do anything. It's not going to have any effect whatsoever on the decline in the hospitalizations. The lieutenant governor stated in his chalkboard presentation that you take the total number, you multiply it by about 4.5%, and we already know as of today, we're going to have double the number of people that are going to have to be hospitalized. There's going to be another 400 more people just based on what we know are very reliable statistics. And oh, by the way, we do know that as of today's numbers, 8 people will die. Okay? 8 more people and residents will die. And
Well, I got to thank you for agreeing to come on tonight, because had I not had a show tonight, if I didn't have a guest tonight, after watching the KITV news tonight, I would have done another impromptu, because what the lieutenant governor said, that we better brace ourselves, because we're going to have 50 to, I think he said 100, either 50 to 80 or 50 to 100 deaths in the next couple weeks. Just like that. Just say, brace yourself, guys. To me, that's insulting, because myself, you, Dr. Miscovich, all of our, we got 251 people watching live now on Facebook. Right now we're on Facebook, Twitter, LinkedIn, and YouTube, all live right now. But right now on Facebook, 251. None of us on this show right now can do anything to stop this, except personal responsibility, which we'll talk about in a little bit. My point is this: is the people that can make the change are the people telling us, brace yourself. It's coming. There's nothing we can do. When there is something you can do, you can do a stay-at-home order for the next 4 weeks. I think, Doc. I think your recommendation is 4 weeks. But we got to stop this surge. What's going to happen when all the other hospitals start declaring internal emergencies like Queens West just did? And then you get a stroke, you get a heart attack, you get a car accident.
the Big Island's already there. The Big Island is already there. Everything, because I have a team over. I just came back from 3 days on the Big Island, and they're all maxed out. The poor people working in the hospital are so dejected. They're just like they don't know what to think because they go in and if people could understand, you go in and you have these people and they're on ventilators and here's another thing you have to understand. Lieutenant Governor said right now there's about 50 people out of the 380 hospitalized that are on ventilators. And he did aptly say 50% mortality, half will die. Half of those people are going to succumb to COVID that are on ventilators right now. They and their families are going to go through this very long, protracted, drawn out death and suffering, right? Their family's going to suffer and they're going to suffer with this tube in them. And it's just so sad. And they're in their 30s and 40s and 50s. It's not just the kapuna, because most of them now are staying in and most of them are vaccinated, right? And again, we're going to highlight that if you're vaccinated, your chances of dying are very, very, very low. But it's just so overwhelming when you're in a hospital because the disease is not treatable. That's the other thing. We get someone in, you got a standard pneumonia, well, you're pumping them with great antibiotics and you find a second antibiotic and you have all different types of medicine and there's a predictability that you're going to help save them. So as a healthcare person, you go in and, we're giving them some of these medications, but the stats on them are not that great. It just takes its own course due to different things that are happening in your body. And you're just, as a healthcare person, supporting them. And over when you have enough experience, you know how frustrating it is when you have someone and you're caring for them. And I'm married to a nurse. My wife and I met over an organ transplant person in ICU. She's an ICU nurse, so she knows about this. 30 some years of marriage, and you have instinct when someone's going to die, and you're just there with them for a month. It is the hardest thing for those people to endure, as well as the families and watching the families go through the grieving. And we're just seeing that all over our state right now. And it's preventable. It is preventable. And it's preventable. And I said this to you before, Mel. If we shut down on Monday to a stay-at-home, work-at-home order, I will guarantee you in 30 days, we will have numbers that will be down 75%. 75%. Because how do I know? How can I say guarantee? Because we know how the disease spreads. We know how the disease sheds. We know how long it lasts. Now, we're still going to have people that are going to be surging into the hospitals, but the peak will stop because the numbers will just plummet. And then my recommendation is we take the 30 days and we just put plans into play that will basically get the right mask into hand, get the right type of setting into our visitor industry, which is probably returning to testing. Yet now we're being told, oh, we're not allowed to test, it's unconstitutional. Geez, where was the Constitution, 6 months ago? And try to get another surge of vaccinations and then have another surge of testing available so that once we go, then the other thing is what we need to do is let our Department of Health get a breath and get prepared to go back to normal contact tracing. We heard it today from the Lieutenant Governor and everybody talking. They're overwhelmed. And again, I'm not blaming the Department of Health. They're heroes too. They're down there working their butts off. They're overworked, and they must be so frustrated because they can't do the job they're trained for. And then we need to get back to the standard of how you control COVID, which is contact tracing. And what's the next thing we don't have right now? We're a third world country right now. We have tents on hospitals, and we have basically the healthcare officials saying, hey, no, we have to go to public health because you don't expect anybody to call. You just stay home. If you get COVID, you're just going to have to stay home. Because the other thing we don't have is quarantine facilities, right? Nothing, right? Oh, hotels are full of tourism. Well, we don't have quarantine facilities for you. So go ahead, infect your family, infect everyone around you, and hang out. And no one's going to call you because we don't have anybody to call you because there's just too many of you sick. And then, oh, we'll send you to a tent in a hospital. Come on, man. We deserve better. The people deserve better right now. We deserve first world care. So
Yeah, I heard today that, and again, it's just that I guess I'm on, and if you wonder why I keep talking about the lieutenant governors, because he's the only one that's been coming forward and speaking. So I rely on the information that he provides because he is our leader in this case. Everyone else has kind of taken a back seat, but in his spotlight, Star Advertiser spotlight today, he mentioned a few things that kind of struck me. One was, as you mentioned, the constitutionality of testing. He's saying because the CDC is saying that flying while vaccinated is safe, that they cannot. Their legal advisors told them, I guess him and the governor, that they cannot implement pre and post tests travel testing because CDC says it's okay to fly vaccinated. Now, that's erroneous, I can tell you, because the CDC, provides recommendations, and also CDC came out, I don't know, a month or so ago, maybe 2 months now, that hey, if you're vaccinated, uh, you don't have to wear a mask anymore. Remember?
oh,
And everybody went nuts. All
May
the experts
13th.
went crazy.
May
Yeah,
13th.
yeah, they all went nuts. Did the governor lift the mask mandate for vaccinated people because the CDC said so? No. We stayed right with the mask mandate, rightfully so, and we have openly and publicly commended the governor for doing that. And I really believe that has kept the cases down at that point. So that's a farce. That's a farce. And the other thing he said was that it's not fair to punish the vaccinated people by putting in restrictions. Um, that Listen, people, we try to not divide the community. We have openly publicly said on this show, we respect the decisions of everyone, but we got to protect everyone. How do you say we cannot punish the vaccinated for those that are not vaccinated? Well, guess what? Everyone that's under the age of 12 is not vaccinated, not by their choice. Don't we have an obligation to protect them? Don't we have an obligation to protect those that are not vaccinated because of a medical condition that prevents them from getting the vaccine? He again, just totally different levels of understanding. I think I just don't see what he's seeing, and this whole thing about consequences to the economy. Wow, I'm really really concerned about that because we are dealing with people getting sick and dying. That's what we're up against. So when you compare sick and dying versus the economy, I think you go 10 to the sick and dying when you're in a situation as we are today. Not, this was all different 6 months ago, 4 months ago, before this surge where all the hospitals across the state, Kauai, we're at capacity. We still doing relatively okay, but every other hospital in the state is at a crisis level. So at this point, how can you even consider anything else but reducing the influx of cases or the exponential growth of cases and illness and death? I don't get it. I don't get
Um,
it.
One of the things, give me 30 seconds. I don't think I did this with you before because I had done some research because I was trying to understand, what is the right and where is the right and, of what is the right to protect because I look at this and I see, okay, so people are unvaccinated are getting the disease, and now people vaccinated are dying, and people are dying. It just seems like there has to be some protection where the protection of the whole of the town of the community, is going to supersede an individual's rights. And this is what came up, and this is just the excerpt of someone that's a constitutional expert that put this together. Article 10 of the Constitution gives state governments primary authority to secure the health and safety of their inhabitants. For example, requiring quarantine, sheltering in place orders, curfews during emergencies. For this reason, the federal government has tended to limit its role in pandemic and to facilitate monitoring, promoting, and manufacturing and distributing of vaccines, and to ensure their safety. In the 1905 case of Jacobson versus Massachusetts, um, all persons over 21 had to have compulsory vaccines because they had a real and substantial relation to the protection of the public health and safety. And in the majority rule, Justice Harlan asserted liberty secured by the Constitution of the United States to every person within its jurisdiction does not impose an absolute right in each person to be, at all times and in all circumstances, wholly free from restraint. There are manifold restraints to which every person is necessarily subject to for the common good. And then it goes on and it talks about the appeals that went on up through 1922 that eventually have been upheld now for the next 100 years that basically have allowed there to be vaccine mandates that occur in the country. And it goes on and talks a little bit about, the same thing goes where you can have a smoking ban that just because you want to smoke, well, it's banned because we know the people around you can get secondary smoke. And so therefore it's illegal. And so I'm not, people, don't throw anything out at me. I'm a doctor. I did this for my own edification to know, well, what is the law? I mean, where's this going? I know there's mandates. As a doctor, we force people to get stuff and TB tests and things like that. Where does it come from? And that's the law. That's what the law. Now, this is going to be fought. It's going to be in the Constitution. It's going to go to federal courts, state courts, and things like that. But it's interesting to see that it is actually coming from the Constitution of the United States of America. It's not something small, and it's going to be fought. It's going to be determined by people who do that and do constitutional law. As a doctor, I look at one person at a time suffering. And one of the things I'm so offended by with our leadership is that they have chosen to be leaders of a portion of the population. And that portion is the people who decided to get vaccinated.
Yeah.
They need to be leaders of the entire state. And I've been out there in the field, and there are so many reasons that the people have that they did not get vaccinated. There are many, many reasons. We all know the people who are reading the conspiracy theories. I'm not talking about those, but there's so many educational, language, mistrust, family, past relationships, things that you look at these good, caring people, and guess what? Most of them are Pacific Island. Most of them are Native Hawaiian. Most of them have a second language. People who have been mistreated forever, right? And may not even have an internet, like down in the south part of the Big Island. They only have like 35 or 36% don't even have Wi-Fi or internet connection down there. So I mean, they might not understand this. And come on, they all deserve to be protected. We have a pandemic that is killing people, that is putting them at risk. And for all you vaccinated like me and you, guess what? We're now at risk if you have a major car accident, if you have a major surgery, or if you have a cancer, which try even to get tests done. You've been put at risk by this whole milieu, right? But you know who hasn't been put at risk? The visitor industry.
Yeah.
Wait a second. Wait a second. So old Mitch Roth over there is going to say, "Oh, residents, we're going to close the beaches down." Close the freaking beaches down? I'll bet you the tourists will be getting tickets. I'll bet you the local residents will probably be told you can't do it. But no, if you're there and you're going in your hotel, no, you're going to be able to do it. Give me a freaking break. The safest place on the planet is going out to the beach in the middle of trade winds, and being safe out there with the beautiful weather, and that's where we get the peace and our brains settled down. And that's the best they can do is say, close the beaches down. Yeah, yeah, yeah. So
Yeah, that one kind of took threw me for a loop. Like, one of the most important things in this pandemic is the emotional health, mental health of people. And in fact, even when we had the lockdowns of past, even when we had those restrictions put in, everyone was allowed. Remember, we were allowed to go to the beach. You were allowed to go exercise around your block, walk down to the park, exercise your dog. All of those things were allowed, and to think that the mayor would come out and say we're going to close the beaches and the parks, where I have not heard of a cluster other than a party at the park. I can see no parties at the park, no parties on the beaches, no gatherings at the beaches. But to close the
sure,
beaches, close the parks. But again, it's this dog and pony show, right? It's going out and making like you're doing something to help, even if it has no real effect. I mean, we all know. I heard the lieutenant governor today say he wasn't concerned about bars and strip clubs. I almost fell off my couch when he said that. Like, where did strip clubs come from anyway? We know that wasn't even the question. Bars, restaurants, anywhere that you have gatherings with people that are maskless and talking and breathing, you're going to have an opportunity for spread. So I understand, and I see one of our guys here saying no lockdown, no lockdown, no lockdown. Listen, I don't want a lockdown, and we all had an opportunity if we all practice smart behavior. If we didn't travel to the mainland for vacation and come back bringing back viruses, if we didn't go to concerts, if we didn't go to block parties, if we didn't go gather at big weddings, and we could have prevented this, but we didn't because we're humans and we do things because that's our nature. Sometimes the government got to step in. We had a little thing today with my good friend on Facebook, and he said, don't blame the politicians, blame the people because they got to practice self responsibility. And this good friend of mine is a former traffic cop with HPD, and I said, imagine if we didn't have a DUI law and we left it on the personal responsibility of the people not to drink and drive. It would be tragedy. Sometimes you gotta set the regulation to protect everyone, not just a select group. And that's what I'm not getting with this governor and this lieutenant governor. They have made it very clear we're not going to mess with the tourists. We're not going to mess with it. So live with it because we all know Labor Day is a great traveling weekend. They're stalling this to get to allow the airlines to get as much revenue as they can before the inevitable happens, which is, for those of you that don't like lockdowns, the inevitable is a lockdown. So if we can chip away now and stop the behavior with a law, with regulation that spreads this virus, we can prevent a complete shutdown. We can, but keep doing what we're doing. I can promise you, the results will not change. The results will not change.
let me make a little bit of a challenge to one of the things you said. Uh, I am not putting this directly on the people, not 100%. This first started, and I made this comment. Hold on, my boss wants to go out to the bathroom. Hold on a second. Where she is.
And I wish I had a dog like that. I wish I had a dog like that.
Okay. Okay. But I made this comment, and I think I said this, I don't know if I said this before, but I think this is going to be studied for decades, what's happened. And I said this on my CNN time, and I didn't want to disrespect the survivors or the people who lost their lives in Pearl Harbor, but I said May 13th will be a day that will live in infamy because there will be so many Americans that lose their lives because of a massive mistake that occurred. And that was when the CDC said, you don't have to wear a mask if you're vaccinated. And what that did is it changed the whole attitude of the country. And I was living it. I was all through the South. And I told you, I think I mentioned this before. And I watched it, and people's masks came off. And I was doing my Olympic testing. I was flying all over doing testing for the Olympic trials. And they were in pretty big cities. And people in bars and restaurants. And before you would see masks, and then all of a sudden you'd just go and you'd see it didn't matter. It was like life was back to normal. People were like, yay, COVID's over. And it was supposed to only be if you're vaccinated. Well, at that point, the vaccination rates were 20%, if best. So that means 8 out of 10 people should have had a mask on. None, because the whole psychology was, well, I don't want to look like I don't have a vaccine. I mean, who's going to know? I just won't wear my mask. And then that's what happened. That's where the spread started. And then this happened. And it just kind of kept steamrolling again and again and again. Um, and we have another massive mistake that's going on. And I've called this out. And again, one of my CNN times, it was CNN International. And I called out and I'm going to do it again right now. I called out the CDC and the WHO because they are again letting people die for policy. Right now, close contact is still defined what they defined it at 1 year ago as 6 feet for 15 minutes. Well, 6 feet in 15 minutes, you could infect 100 people, not just one. The new definition should be 2 minutes and 6 feet indoors, 5 minutes and 6 feet outdoors, because most of the states just rubber stamp whatever the CDC. And I'm hearing when there is contact tracing or people trying to define, they're going, well, I'm not a first degree contact. I can go do what I want to do because I was only in the same room as them across the table from them for 14 minutes. And it's just the Delta variant is so contagious. It has changed everything. That's what everybody has to understand. Everything that we know right now is changing over a period of 2 months. And has CDC done anything to change anything over the past 2 months? Nada, nothing. They're basically doing the same thing. They're still trying to study the same thing, and they're still trying to think about the same thing, and it's causing people to die. Okay, this indecisiveness, this delay, it's not policy or thinking about it. It's Americans are dying. Pediatric ICUs in Alabama, full. Pediatric ICUs in Louisiana, full. The entire states. So for those who are not worried about our kids in school, it's time to be worried. You know,
Yeah,
it's time
that
to be.
that's the other. And I got a couple of dots over here that we want to discuss. One of them is schools. There is, again, mixed messages, because if you listen to the Department of Education, they said that there's it's safe and there's no real no real danger. And then you read the numbers that the DOH puts out, how many kids are getting infected. We had a whole school shut down. DOH shut down a whole school here on Kauai last week. And we know, I mean, see, that's the thing. When you live in a small community, especially here on Kauai, we know everything through the coconut wireless. We don't have to rely on that information from DOE or whatever. But we know for a fact that kids are getting sick. The other thing the lieutenant governor said today, which really pissed me off, he said 2 kids are in the hospital with COVID across the state. Only 2 kids. I know that's not true. In fact, as we were watching this thing live, I was getting messages from people that work in hospitals that said that is a lie. That they have more than two just in their hospital alone. This was a hospital on Oahu. So again, the minimization of this thing is not helping anybody. In fact, it's creating a bigger problem. We just got to be true with the people and tell them the truth. But which testing? I mean, not testing. Schools. What's your thought on schools? I mean,
Close close them down. They should have never started. You guys remember I came on 2 weeks before the school was supposed to start, and I was the only one. I went on the news and said, we need to not start schools. We need to have a
yeah,
delay until we can find a policy that can teach the schools how to effectively manage COVID. And they haven't started testing in the schools yet. They haven't, some of them are, but let me, hopefully some of the listeners that know me are looking at me and saying, like, dude, calm down. Well,
yeah,
because I'm normally a little bit more, but no, I'm so far at my breaking point right now. And it was just re-emphasized when I went over right on the front lines, right as I was the people there with my team, putting swabs in people's noses and vaccines in people's arms. And we go to a public housing area where low income people, we do 88 tests. The next day we had 36 out of 88 positives. And here's 2 points I want to make. It is garbage. The breakthrough rate right now, we did our calculations just on our test that we have positive, which we have, 300 or so in the last week, or 400 on the Big Island, or done by my team. It's 30% or more. So now, granted, those people will not die. That's okay. But I'm hearing stuff where the Department of Health say, no, it's only zero point 0.3. No, it's massive. Delta is very, very contagious. So one of the things I want everybody to understand, we keep talking about, well, we're 61% vaccinated and 68 or 69% dual vaccination and things like that. So we're only dealing with that. No, the whole state is at risk because of Delta variant. If you are vaccinated, you are not going to die. That's very unlikely. I don't want to say you're not, because we've had some of our elderly who have, but the risk of dying is really, really, really low. But your chances of getting infected, you have to be careful, people. That's why what they are saying is true. But to our leadership, why do you think our hospitals are overrun? We heard today 10% of the beds are full of people who have been vaccinated. So that's 30 some. And then if we get another 400 in, there's another 30 or 40. And, we know inevitably we're going to have children and more children, because guess what? The second point I wanted to make, I'm over there everywhere we turn around. Mom, my son was in school. This friend was positive. My son was here, is positive. It was ubiquitous through the Big Island. The school spread. It was everywhere. Everywhere we turned around, the spread is through the school. And so, hey, I never met Larry, the new head of the DOE. Heard he's been through the ringer and things like that. But I lost faith in him today when he came back and says, "Oh no, we got great plans in play, and everybody, and there's really no spread in school." He came and said that, and I've just been in the front lines, and I've been in front lines here and there, and it's everywhere. It's everywhere. Spreads are going everywhere, and the other part is the parents can't even find a place to get their kids tested, so we don't even have a grip on how much disease is in our schools. So, if you're listening, oh, geez, don't send your kids to school if you can avoid it. The wrong time to send them to school, and secondarily, schools are going to end up being shut down. It's just inevitable, because this is going to rip through our schools, because it's impossible to be safe in our schools, which are outdated and have a lot of gaps and deficiencies. And the poor teachers and the poor principals, believe me, I'm not making anything up. 35 years son of a teacher, so I grew up in a teacher household of a teacher. They're blessed people, and the teachers are out there busting their butt, and they're at risk too. I feel bad for our teachers. I support what the teacher association is, because they've just been thrown in the middle of this with like nothing. And then the principals are even worse yet, because they get a piece of paper, and then they're supposed to keep the whole planet safe, and all the parents. It's wrong. It's just totally wrong. So,
Yeah, I and I realize for some parents it's difficult. It's difficult to keep your child home, but I think when you look at the potential risk, it's a gamble. I mean, it is. I know Governor Ege said it's worth the risk because education is important. I'm not disagreeing with him that education is important, but I do disagree with him that it's worth the risk. Lord have mercy. What would you put your kid in a place that with that much risk? And the thing that it makes it even worse is the DOH has a policy that their close contact, doc, as you said, 15 minutes, 6 feet apart. Well, you in the schools, majority of the classrooms cannot maintain the 6 feet. It's 3 feet difference or separation. But if you come in close contact with a infected person, and if you're vaccinated, you don't have to quarantine. You go right back to your normal. You don't have to test. You don't have to. You just go back to school or go back to work, and that I believe is causing some issues too, because we all know vaccinated people can still transfer the virus. So there's a lot of things that I question at the state level of, are we being as safe as we can? And I understand some people think it might be overreacting, but guys, take a look around you. We are in trouble. We are in deep kimchi, deep kimchi, and it, I guess we just got to ride it out. People gonna die. We just got to accept it
Now,
and move on.
let me make another statement, a plea to the people. If you have a child who's not vaccinated and they have any remote health condition, whether it's moderate asthma, and I got to be fair and be blunt, if they're overweight significantly, or God forbid they're already starting some diabetes or things like that, or anything that they've had to be hospitalized, or don't send them to school. They're at risk. They are going to be up a few tiers and be one of the ones that could be the next hospitalization, or God forbid, more serious and put in ICU or more. So please, don't. I mean, again, I'd be really questioning, you know, the value. What's 1 month? What's 1 month in a life of a child? What's 1 month of closing our school and getting a plan in play and letting this calm down in the whole life of a child? God Almighty. Uh,
You
but
know, my my daughter was supposed to get vaccinated the day she got sick, and it just came to mind because what's 1 month? Yeah, why wait to take a vaccine? Because once you get it, it's too late. And I remember you before school started, Doc. You were on the news. You blew a gasket. You were upset, and you were warning everyone, do not. I think you at that point you said wait 2 weeks. It wasn't it. Maybe you said. I think you
yeah,
said
I
two
said
weeks.
I said a minimum delay opening for 2 weeks until the plan comes out to show what the plan is to keep the kids
Right.
safe, right? To put testing in play, to put education in play, to put the proper masks on our kids. And remember, Delta wasn't even surging as bad, but I knew it was coming. I mean, come on. I've been saying this on the show forever, just like the other people that we trust as experts. We know it's coming. We know where we're going to be in 2 weeks. That's a problem. That's why we're sitting here so upset, is we know where we're going to be, and we're going to be sitting here, and every island is going to be going like this, and there's going to be no more federal workers being sent, and there's going to be more tents in your hospitals, and the number that follows the total number, that's the number of deaths. It's just going to keep on ticking up and ticking up and ticking up, and the
That,
people.
that that's I think that's why it's hard for people like you and Dr. Chiba at UH and Dr. Altenberg, who the analysis have been done. See, you can predict, because this is a very predictable disease. It's
Exactly.
a very predictable, as you said, you know what it does. So based on numbers, based on math, you can tell exactly where we're going to be in 2 weeks. In fact, Dr. Altenberg and Chiba's, I don't want to say projection because it wasn't a projection. It was a if then analysis.
Yeah,
Was right on target, right on target. And Dr. Chiba said, math doesn't have a political agenda.
that's right.
Math doesn't have a political agenda. Now I ask you, Doc, had we taken your advice back then and waited a minimum of 2 weeks, had we waited 2 weeks or 3 weeks until the Department of Education came up with a plan that was going to provide a safe environment, how many kids would have been saved? And when I say saved, I mean not
Well, we
not
had
getting.
380 last week, 300 and some this week. By the time we get the real numbers, we're going to be already closer to 1,000. We already have a
Right.
thousand kids are going to be affected in our schools. Now, here's the
Yes.
other part of the math that's not going to lie. 8 people get it from every child. Every infected person, now we're at least 8 to 1 with the spread factor, since this is so ridiculously contagious. And do you know how many people are going to get COVID because we let the schools go with no real plan? It's massive. And again, I'm not knocking DOH. They really wrote a really solid plan. Their solid return to school plan was really well done, because I'm working on this all over the United States, and I put it right up there with the top. But we didn't have time to implement it. We didn't have time to teach it. We didn't have the time to put the guardrails up and the safety procedures in. And then we didn't, and the bottom line is that here's the other reality check. In the long and short of it, as Delta kicked, 2 weeks would have made a hoot a difference, because then what we should have just done is realized, because Delta was so ridiculous, they should have gone back anyways.
Yeah.
So I would concur that, that was just my thoughts back then, because remember, that was what, 6 weeks ago or some period of time ago. And so at this stage, I would have just say clearly that we would have just have to shut it down, and
Right.
not even put the kids back. And I just think that the DOE has to shut down. The kids should be shut down. I support the teachers union, because there's so many teachers that have been teachers for life. They're at risk. There will be teachers that, if they keep forcing this to go, there'll be teachers that will get COVID and be hospitalized. There could be teachers that could die on the job because of this decision. What, they're just going to be like, oh, well, it's just part of the COVID, it's part of what's going on.
Couple more things I wanted to touch on. I know someone is asking about the treatment, um, because there is treatment for COVID once they go in. But I remember Dr. DeWorkin, when he was on our show a week or so ago, he said the treatment for COVID, these different treatments that are available, uh, doesn't really do good things to your body. You don't really want to give this treatment, but because of COVID, you really have no choice, and that's why he was kind of promoting getting vaccinated, because you don't want to end up in the hospital where to keep you alive and give you a shot, you got to take these treatments. But there is treatment out there, right? I can tell you, there wasn't
The
anything
whole the
I
whole
thought.
concept is treatment versus treatment for other illnesses versus treatment for COVID are
Yeah.
two different things. When we think of treatment in medicine, I bring up pneumonia again. You get a patient that comes in with pneumonia, you really know that you have a pretty good number of arrows in your quiver, and you're going after them. And if they don't respond, you're hitting this one, then you're hitting them with two things, and you're hitting with three things, and then you might come off the side. And as each progression goes, you still have multiple things you can do. And the chances are this patient is not going to succumb to it, because these things work, right? So you get people in, and one of the things, to get a little wonky, they get this what's called cytochrome storm, and that is where the COVID starts, and your immune system, these warriors just storm everywhere, and that's where the blood clotting and your whole system is just going in directions that we have not seen in modern medicine. What happens to your body physiologically with COVID is unlike anything we have ever really seen. Maybe there's a few rarities, you might say, but as a whole, and it just kept getting worse and worse and worse. And so you're trying to do these salvage things. It's almost like if every play of a football game was a Hail Mary pass. And that's the difference, is that there's that. And when you throw a Hail Mary, well, two safeties are going to be back. Someone can tip it and someone can intercept it. Well, that's the same thing that's happening right now, is with some of these treatments. There's no sure thing. One person responds, one person doesn't respond. Some of the things early on we know that have worked is steroids. Some other things, we have the monoclonal antibodies that we're using. We just got a study out today that shows they're not that great if you start them early in people who have just been exposed, but they will work further on and do help. And then you have, there again, I could go through handfuls of things that, yeah, that's why at the beginning mortality was up here, and now it has
Mhm.
dropped, because some of these things are giving us another option. So yes, but what I don't want to do is have anybody understand that false there's false hope, that there's like the
Right.
magic bullet antibiotic or the antiviral that will take it away. Once you start progressing into an ICU phase, it's just holding on survival type of treatment. So yeah.
Yeah. All right. Thanks for clarifying that. It's just a terrible disease, and there's a lot of people out there minimizing. A lot of people are saying, "Well, the recovery rate is whatever. 99% of people survive." I got to tell you that bothers me when people say that, because we know, and I'm sure you know a whole lot more than I, that the long haulers, the people that have lifelong ailments because of this virus, I don't know. I mean, all of the survivors that we have, and I call them survivors because they've never recovered, have had some kind of medical condition that stays with them, whether it's stamina or
Well,
breathing or
we're starting to get a lot of information out in our medical journals, and some of these are major. The JAMA, et cetera, are coming out with 8 to 10% of people will be permanently disabled. Permanently. Okay, that means they'll never work again. Uh, So for all you people who are out there wanting to say, just a flu, yeah, no, this is nothing. Don't ever. It just frustrates me when I hear someone that says flu and COVID side by side. It just frustrates me like crazy because this disease is so devastating, and the mortality and the number of people that have died and the number of people that are going to lose their lives. And that's the other thing. Okay, so we're 1.2% or something right now in the state of Hawaii. But guess what? Of all these people that have got contracted COVID, another 500 are going to die in the next 18 months, and then another 500 are going to die prematurely, probably in the next 18 months, and then maybe another 1,000 will die in the next 3 years. You're not going to survive after your lungs have been ripped apart by this virus and they've been liquidated, which is what happens in a lot of people, or your heart has been, basically destroyed by this virus. Your heart's now 75 or 80-year-old heart. You could be 35. So the mortality in the next 5 years from people who survive will be significant, and the people who will be walking on oxygen is significant. So please don't even start using the word flu. I've been
yeah.
practicing medicine for 33 years, and this is nothing like this is ever written in modern medicine, in ancient medicine, anywhere. This is beyond anything we've ever dealt with.
We got about 10 more minutes. FDA approval coming soon. I know the lieutenant governor said probably next week, but it is going to be coming soon. Any insights on that? And I do believe that that's going to help get some people convinced to take the vaccine. But
I
I still don't think it's going to make a big difference in the current surge, because it does take some time for vaccines to build immunity.
I've been a naysayer on it because I'm in the field. See, here's a big difference. I'm not just sitting here talking on a computer. I'm all over the United States. I have teams of people out there. We're vaccinating, testing all over. I deal with my people. I talk to my people, and I go to the front lines, and I talk to people who are actually doing it, or I will actually do it myself. I'm a doctor, not a politician. I don't care what your political background is. I want to help you. And I talk to these people. And I think I've said this on my CNN and CNN International. I think maybe 3%, maybe 5% bump max in the United States, because it's just not that big of a deal. Because I guarantee you, go ahead and ask any soul out there, what does an FDA approval mean for a medication? How did they do it? No one knows. No one's really aware. You have to study it before you understand what it means. And, but what is going to happen is Katie barred the doors, man, because the mandates by employers, states, offices, everybody's going to look and say, you are now required to be vaccinated, right? That's what is going to happen. And then that's going to tie in that stuff I read at the beginning with the federal laws to say, are you allowed to do it or not? And that's when the juggernaut's going to come together of law versus vaccine versus public right and things like that. And it was going to be decided way outside you or me. And That's what's going to then push. And guess what? The vaccine's going to win, and the people are going to win, and the employers are going to win because they already have been winning in courts. And this is going to be made mandatory, and people are going to have to. And then we're going to get the next 10%. Then we'll start getting a significant bump once it becomes mandated. And people don't send me hate mail or anything like that. I'm just explaining the facts here. I'm a doctor. I'll treat every one of you. I'll treat every one of your family. And if you decide you don't want to have it, you don't want to need it, I'm still going to treat you. That's what I do. We're still going to treat you as a human being, unlike our state, which is basically now has a divide, the vaccinated and unvaccinated. Unvaccinated, well, you chose, go die. You can die.
Yeah,
That's
I think that is very dangerous, and we again we respect and love everyone. I mean, whatever your belief is, and I don't like when they villainize the unvaccinated people. I really don't. I think we need to spend time and educate and try to inform them that that's the right choice, but that's their choice, and that's why I appreciate your transparency and your candidness. The other thing, and I know you're a testing expert, and I had a message from someone today, and I'm going to pull up the message because they asked me to ask you. Hi Mel, I think you guys should discuss with Dr. Miscovich the necessary deployment of at-home rapid antigen testing for screening, not diagnostic use. Everyone in the USA, anyway, because part of the solution is personal responsibility. We've been talking about that. I call it the personal lockdown, where you don't need the governor to tell you you cannot go to a bar. Just don't go to the bar. You don't have to tell the governor to tell you that you cannot congregate, and just don't do it. If everybody did it, it wouldn't matter what the governor did. But we human nature again. So, but is getting to this gentleman's question? They have over the counter testing kits now that we can buy, and I never thought of that, but I'm thinking while I was getting ready for the show, that's a damn good idea. If everybody had a supply and was able to test their kids every day or every other day, whatever it is, what's your thought?
Oh,
So,
that has been the ticket out of this from day one. That was popularized by Dr. Michael Mina out of Harvard, and we all agreed that those antigen tests are not as accurate. But if you did them frequently, what happens is those antigen tests are almost foolproof when you're really at the high point of shedding. Remember, everybody's seen you start like this, and then this goes up like this, and it's this big slope. When you start hitting that slope, that antigen test will be close enough to detecting it, even though it's not that expensive or good. And that's what you want to know, because that's when you're going to give it to another child or give it to someone around you. Now, in that early phase, when you're just starting to slope, that's where the PCR will catch it before you can shed it. That's why the PCR is a gold standard. But yes, if we could get to a point where every mom and every person going to work just had a little slip and a little thing, and they say, okay, time to check. Here, honey, spit in this, or let me swap you with this and do this. Oh, you're positive. We're going to keep you home today. Sis, you got to stay home because brother's positive. Yeah, it'd be the greatest thing on the planet. That's what we would all hope we could do. But, you know, our federal government has screwed this up so badly. It's just like all over the planet. We have bunches of shysters out there trying to sell knockoff cheap tests that are inaccurate, that don't do what you need. There's not a lot of guidance. They're letting the states do. One state does one thing, and I'm all over the country. One state does one thing, one county does one thing. One of them uses one test, another one allows another test to go out there. One of them approves this. It's the Wild West, out of control, with very little guidance across our United States. And I'm telling you, the CDC, in my mind, has held a lot of the responsibility for its failure and its leadership. So I don't put it all on the people. I put CDC holds a lot of it, because then a lot of states are a little bit lazy and they do the cut and paste. Whatever CDC says, they wait, they cut and paste, they put on their website. Well, guess what? That's not what the CDC is. The CDC is this massive, slow running federal organization that studies and looks at something. It's not FEMA, it's not an emergency management situation. It's a big governing body. Are they eventually good at what they do? Yes, they're eventually good at what they do, but they're not good at a pandemic. They're not good at speed. And the other thing is, what we have 340 million people. And can you tell me that what Kauai is facing right now versus what a province in Louisiana is facing is the same? Or what about up in North Dakota? Hell no. It could be totally dramatic and different. So, what one state or county has to do is they're supposed to take the CDC guidance, customize it, look at it with their health experts, modify it, accept it or not, and make policy. That's what the CDC is. But so many people are so lazy, they cut and say, well, cut and paste, CDC says it. And we are sitting here looking and like, no, no, what are you doing, state? Or what are you doing, county? That's wrong. Oh, but the CDC says it. And you go, it's right in front of you. It's wrong. And that's where, you go with that 6 feet and 15 minutes. It's just hideous, some of the stuff that the CDC does, and that the lemmings in a lot of the states just right over the cliff with them, right over the cliff with them.
So I know there's a lot of rubbish tests going on. You go online, don't buy your stuff online unless you know what you're buying is valid. Doc, real quick, any suggestions for these tests? Any brands we should be looking for? Or
Yeah, the over-the-counter tests that come from BD, and Abbott and Quidel are solid. Okay, so why would I say those three? Now, I would of the antigen test that we use, I've chosen BD because I found it to be way more accurate than the Abbott test is way on the lower list. But the home tests, the reason is this: those three companies, BD's been in the United States, a laboratory manufacturing company for 125 years. Quidel, 75 years. Abbott, like a long time. These are really high-end, reliable companies. What happened then is everything else, you had Japanese, Chinese, Korean products that they hurried up and found. They came in, they decided to try to make money off of COVID. They went in, modified it, changed it, and then Americanized it, and they start selling it. And we're like, well, what's this company? Where they been? Where are they from? And you just track it right back, and you just realize it's just a costume on top of something that was a cheap knockoff that was coming in before. Those three companies have been the mainstay of healthcare, and they will be the mainstay. So if you're getting a home test, Quidel, BD, or Abbott are all out there.
there you go, guys. I have one last question, Doc, and I promise it's the last question. And this is to Nani. Nani, this is Nani's question. I traveled to the Big Island as my son passed away. So sorry, Nani. Prayers, condolences out for your loss. She returned on Sunday, took a COVID test on Wednesday. It was negative. When should she take another COVID test?
Um,
Arrived on Sunday.
when do you think she was exposed? That
It's,
was.
it's not related to exposure. It's just personal. I think it's just
Um,
she went because she traveled to the Big Island.
I would do it on day 5 is probably the best time, because remember, day 4 is probably pretty safe also. One of the things that's different with Delta variant is the incubation period with the original Delta or the Alpha COVID was 5 to 6 days. Now it's about 3.6 days, 3.7, 4 days. So at 5 days, if you're negative, it's pretty good chance you're going to be negative. You might start becoming symptomatic at 3.5 or 4 days. So it is a little shorter period of time. I think 5 days is a pretty well guaranteed window. 4 is pretty solid too. But everybody remember that. The other thing everybody should remember, total change in the way Delta can present. Sore throat, runny nose, stuffy nose, headache, still very common. Then you might progress to a little bit of cough, but it comes on as allergies. It comes on as a very minor common cold. Those are the presenting symptoms. So just be prepared. Don't look for the biggies. And then you get your butt kicked and you're getting fever and you're getting achiness and things like that. But yeah, I do have a question. Did Nani lose her son to COVID? I mean,
I
that's or
she didn't say. I'm not
either
sure.
way, either way,
Yeah,
a parent should never have to bury their child. Sorry to hear
yeah,
the loss. That's just
yeah. I gotta say this show has created a village. We're all one big Ohana, and it really hurts when we see we've that's the unfortunate part about this show is we see so many of these stories, some COVID related, some not COVID related. We've seen so many families lose loved ones, and it hurts, man. It breaks, and that's why I'm so passionate because I don't want to see anybody get sick. I don't want to see anybody get die. And for those that feel that this is a hoax, which is what my daughter is going to tell you tomorrow. By the way, guys, tomorrow night again, 6 o'clock, we'll have my son and my daughter. My daughter's going to share her story of how she thought COVID was fake, and I'm hoping again, if you guys got kids, grandkids, get them in front of the thing tomorrow night, 6 o'clock. But yeah, Doc, it's so sore sometimes, and that's why we got to continue doing what we're doing. We appreciate people like you coming on and just being honest and real. So,
yeah. I'm so
any closing thoughts, Doc? You got
yeah,
the floor,
yeah.
buddy.
I do. I do. First of all, been on your show a lot, and sorry to everybody because you got the pissed off side of me tonight, man. There's no doubt about it. I mean, I can't say any other way. But okay, Mel, I've lived my life like this. I have always lived by the motto, and this was trained into me young: don't complain about something unless you have a solution for what you're complaining about. And we've gotten into desperate situations, and I'm going to give everybody a shorter solution, because what I'm saying about lockdown, it's like before I was saying we need to have other plans, but right now with the Queen's issue today and the numbers we're seeing in the deaths, I do think lockdown's inevitable, school's inevitable. But here is what the leadership should do. If you or me are governor, or we had any kind of power or anything, what should happen right now is it shouldn't have been a state holiday for the cabinet and the leadership. I would activate the Diamond Head over there, because this is an emergency. This is a pandemic. This is a crisis. We had a hospital closed with a crisis. Our state is putting tents up. And I would put and bring in General Hara. What do? You need to bring in emergency management, because we need someone who has a mindset of emergency management. And we have a circle of people where the leaders of our state will go to General Hara and emergency activation team and say, in 48 hours, we want you to come out of that crater with a plan to stop this disease and stop this spread. Because right now, what we have is we have a governor who then kind of turns and hangs out with the mayors every Tuesday. And we've taken a healthcare pandemic and made it a political circus. And a political circus where, the last I counted, Governor, he doesn't have any medical training. No. Mayor Victorino, no. Mayor Roth, for sure not. And your mayor, no. You know, go right around the board. Mayor Blanchard, nope. Put it in the hands of people who understand emergency management. Then let them get surrounded by people who know how to do emergency activation, because we need emergency activation of whatever the final plan is now, not this dicking around. Well, we'll do something in October, or we'll throw one little test site out over here. But you put an emergency activation plan in, you surround healthcare experts with the military leadership, and come up with a plan. That's what they're trained to do. But you know what? We've minimized them. We've taken those people And we've basically shoved them under the table. And we've just let this become a total political circus. So everybody's kowtowing to the visitor industry or kowtowing to this special interest. Wow, Hawaii is in crises and people are dying. That's the solution that should be in play tomorrow, and we should have a result by the next 3 days. And I could lay down 7 plans that you would put in play to make this all happen. But that's what I would recommend. It's time. This is a crisis. So, sorry.
No, I share your pain, my friend. I share your pain. I don't know, flabbergasted. I'm pissed off. Obviously, I just the problem, like you said early on, is we feel helpless because there's nothing we can do to get them to do the right thing. It's unfortunate we're at the place we're at. It's unfortunate, but it was inevitable based on, we know what works. We did it before. We got through the surge, um, and we were able to manage. And I think now is the time to go back to doing what we know works. They're not. So now it's up to us, and we all got to do our share.
Yeah.
So with that, Doc, I want to just say thank you again, for sharing tonight with us. By the looks of the comments, everybody, of course, you got people that just they come on to engage negatively, and that's fine too. I don't block nobody unless it gets personal. And if I see a personal comment, I block it. But I haven't seen the personal stuff. But we welcome all everybody's input. We do. We want to hear from everybody. But Doc, you answered a lot of questions for me. I know for a lot of our questions, I mean, for a lot of our guests. Lisa asked, "I'll be returning resident to the island. Should I take the COVID test again when I'm back there?" Yes, as the doctor said, on
Absolutely.
day five. Day 5. Okay, day
Yeah.
5.
Yeah.
General rule of thumb.
And Mel, personal thanks to you and Charlie, because you guys have stood through this thick and thin, and you've maintained um, truth and honesty, and I don't know how you do it every day, because you can just tell, I'm just like sitting here, because as a doctor, when I see one person die, that's one person too many. I don't care what it is. I don't care if it's a homeless person or a drug addict or a bank president, or it doesn't matter. No one deserves to die. If we can prevent it, everyone's preventable. Every loss is preventable right now. And thank you guys for standing up and still giving the voice to the people who need to hear it out there. So thank you.
Well, I'm sure we'll see you again, ladies and gentlemen. Again tomorrow night, if you're free at 6 o'clock, I'll have my son and daughter. Again, not to showcase them. It's really for them to say their story, share their story. For those of you that have kids or grandchildren that may be on the fence, may need to talk to somebody that's on their level, their frequency, because that generation is messed up. You just gotta, maybe gotta put them on the same frequency. We're gonna try whatever it takes, guys. I'm gonna try new things. We're gonna do whatever we can to get the word out. So tomorrow night, 6 o'clock. We're going on an hour earlier because of the time difference, and she gets winded, she gets tired, and we want to get her to bed early. Next week we have I don't even know. I know we have a special day. It's going to be next week Tuesday, and I'm just going to share it right now. But I talked to my pastor, and I said, Pastor, we need a show of positivity. We just got to have a show where I can talk story with my pastor, and we can just share. I don't even know what we're going to talk about, but he's funny. Pastor Matt Higa, New Hope Kauai, and we'll have some fun and just change it up a little bit, because I tell you what, you guys all know, and I tell you almost every night, if I remember, before you go sleep, you pray for all our people that need help, our leaders, for wisdom and strength and knowledge, but for all the people struck with COVID, whether they're their parents or kids. So we're just gonna bring him on to have some fun, and he'll tell
Hey,
us some jokes. His jokes is much more funny than Charlie's jokes, I can tell you that.
hey, Mel, we got to. I got to at least tell my joke from earlier, because Mel and I talked earlier today when the Queen's news came out, and he was talking about he needed his pastor, and I asked if his pastor was Jack or Jim, and that was Jack Daniels or Jim Beam. So I'm glad it was Pastor Matt. So that's
Yeah, no, it was Pastor Matt, man. I gotta tell you, I stay away from alcohol because now is not the time for me to get. My biggest fear of drinking some alcohol right now, and my wife's biggest fear is after I'm drunk, I do a Facebook Live.
Oh my God.
Anyway, what is this here? When are not getting on the narcissistic frequency in that what you are talking about? I don't know, Johnny. I gotta go read that one later. I think I missed it. Anyway, guys, you guys all stay safe. Take care.
Aloha, everybody. Same thing.
Bless. You guys all have fun. Oh, who is this?
Thanks.
Oh, shucks. I get Akiona. Who is this? Hello.
Okay, it's okay. Misco
How did
one. No,
you?
it's okay. I was just
Were
watching him. It's okay.
Were you on this whole time?
Part of it.
How did?
I had to work late, so it's okay. I was
Oh
watching.
well, Doctor Akiona. I'm sorry. I think Scott
No, no,
left.
no,
I
it's
didn't see
good.
you.
I was watching. You guys are fine.
Anyway,
I was
guys, if
working.
you we still get 269 people on. So
You guys are
what's up?
fine.
What's up, Doctor Akiona? What's up?
Oh my god, a lot. No, he just wanted because I'm on the Big Island, so he usually tells me, but I was working late, so
Oh, okay. I did not see you pop up. I
that's
apologize.
okay. I
I
was keeping him company, and I text him usually for while he's on, and then so if you see him look down, it's usually he's checking for message.
everybody's posting. Mel, you're still on. You're still on. I know
Yeah,
we're still on. I mean,
no,
I was thinking, who is this on my screen? Because I got to push the button to let you in, and I just didn't see you there. But anyway, for those of you
anyway,
that don't know, this
don't
is
worry.
Doctor Akiona from the Big Island.
Yeah,
Real
I'm with.
quick, real quick. What's going on Big Island? It's scary on the Big Island, Doc.
Oh yeah, yeah. I mean, I think lots of people have been hearing me. I know, like just like with Misco. I mean, I'm sure you guys are tired of us, and I think the reality is this is a provider shortage. We're literally everywhere because there's nobody else. But yeah, it's scary. I mean, we are same kind helpless feeling that you guys are having. We're getting overrun. We had small rural routes that we were trying to make sure that everybody had access, and we were using it for our vaccinations, and people are basically needing testing right now. So I mean, right now, and we're getting overrun with the businesses that are losing. You know, they're get the positive exposures are taking out their workforces. So it's just kind of how do we keep everything intact and jerry rig things and still be safe, and then just kind of fill in the pukas that are left when we gutted the resources for all of the um, isolation and contact tracing. So that's where we are at. And my old group that's at the hospital, I mean, they did what, like 6 admissions for COVID, which I know for my friends in the mainland that's not as much, but for us that's huge. um, no
Yeah.
more space, no more space anywhere. Two SNFs, they had COVID, so we cannot transfer, and then the other ones are full, and then EDs are full, and then Oahu is full, so we cannot transfer to Oahu. So yeah.
That's what we share that in common. The mayor was on the on the news tonight, and he said that as far as Kauai's resources, we only have, I hate to say only, we have two COVID patients in the hospital, but our hospital is full. So
Yeah,
because hospitals don't only serve COVID patients,
yeah, yeah, yeah,
so the fact that you have two, so the mayor made it very clear that we're at a crisis, and when people look at the numbers, Kauai, you only had 26 cases today. Yeah, we only had 26 cases,
that's
but we only have
huge.
70,000 people. We only
Yeah.
have nine ICU beds.
Yeah,
So
it's recalibrating what people understand, I think, and that's hard. It's hard because even our own. I remember a year ago, it was explaining to people why just a small bump in the ventilator usage mattered because we have a volcano, so we get asthmatic, COPD. We had the brush fire, and our
mhm,
COPD guys were like, we had to hurry up and just kind of send people medicine to keep them out because you're right. Yeah, I mean, my friends remind me they're trauma surgeons. They're like, trauma still happens. We still get car accidents. We still get guns. We still have fire, and we're all so the sphincter tone is definitely pretty high on our island right now for the
yeah,
providers, at least. Yeah.
wow. So what's your take? I mean, what is it going to take? Coming from the medical profession on the ground, boots on the ground. What really is it going to take for us to get
Just
through this?
your personal lockdown sign. Yeah, I mean, that's what I've been telling people. I said you cannot wait for the government to tell you what to do at this point. Yeah, I told them like the it feels helpless right now, but everybody has a little bit of power, and so it's basically like I told them a year ago. I was telling you guys, behave as though you have it and behave as though everybody else has it. We got to go back to that. We got to take responsibility. I mean, and it's not because you did anything wrong, it's because we're all in it together. And then we just got to be, I was like, family lockdowns, and you got to support your neighbors, because right now, I mean, I got 180 something positives that we're following in my practice alone. And a lot of them, we don't have the resources to get them food, to get them before it was like, if you needed to get isolated, we'll put you someplace, we'll get you your food. They don't have that anymore. So now we're relying on the goodness of other people to kind of check on people, and like bring people water. And a lot of our communities, there are people that exist on the fringes. I mean, the fun thing about the Big Island is we got some people who live literally off the land, and uh, we have very odd ways of how we have to figure out creative ways of getting people to be safe. And then on top of that, just the regular life stuff.
Yeah. Well, I hope that people can understand and realize that we have some responsibility, and we all don't want to see a lockdown. No one wants to see a lockdown, but I
No.
think we've crossed that line. I think we've got to a point. Somebody said, "Hey, they're going to wait till we get to a point of no return." We're there. I mean, we are at the point of no return. The exponential growth of this virus is beyond our control, and if we don't change what we do, this exponential growth will continue. And you've seen it already in the hospitals throughout the state. It,
Yeah.
it is pretty scary, and God forbid anyone gets injured, trauma, non-COVID. It does, again, it's just not for COVID.
Yeah, and it sucks because it's like, I told Misco earlier, it's like, you wish you just didn't know. Like, I wish I didn't know as much, since because like a lot of it is we're watching the other states, we're following their trajectory, so we kind of know what it looks like in the future. And then a couple of other places are behind us, so where they're at right now, we're telling them in 2 weeks you're going to be where we are today. So it's like, it's it's I just watching the nonchalance, and kind of, like people are, leadership, it's just kind of, it's, I mean, I've lost my cool a lot the last few days, and just me and Misko are just like, ah. But just,
I don't know how we get through them. Maybe it's I just don't know. I mean, I watched the press conference with Queens West today with the CEO of Queens, and he's they all got to be politically correct. I don't know why, but they choose to be politically correct, and they're talking about how we people gotta stop
yeah,
gathering. But you know, as I talked with Misko earlier, and I said, we're humans. Human nature is to be
yeah,
social people, and we tend, I know them. Oh, I work with them. They know COVID. They got vaccinated, and we end up, the little talk story session with three becomes six, becomes nine, becomes 12, and then you get a gathering. You get a social gathering, and it's hard to stop that. Uh, so we got to take it upon ourselves, and do what we can.
yeah. Yeah, and then I think, it's just, I think what's been effective lately is just kind of acknowledging to everybody. We sit with people, and we're just like, look, I know you're tired. We are tired too, but then just the little things matter. And then if all of us do a million little things, it's going to make a big difference. And so, like, last week we were in Konowina, we did vaccinations, and we weren't even sure people were going to come. And we did have some protesters. They had their say in the corner, but I mean, like 117 people came to get vaccinated. So I mean, and then a couple of people had some questions about it. It's really about getting good information out to
Mhm.
people, because I think most people, they just want to be heard, and then they want actionable items. Like, how do and it's helping them ask the questions that need to be asked. Like, so I think even a lot of the leadership in business, in different business communities, in education, they just need to know how to ask for what they don't know where to go, or
Yeah,
how to. And so we're helping them with planning, like, what if we do a grassroots kind of coalition, so that we all, we can embed a little bit of knowledge about testing and surveillance and contact tracing in all the districts, and we just do this grassroots from the bottom up at this point. And then how to hold people accountable, and how to have the conversations, and you ask them the right questions. Because I think right now, it's just all of us are the few healthcare providers that are remaining in like this provider shortage. It's we just got to arm the rest of you guys with the same information so that you guys can ask the intelligent questions and you guys can be our, like part of our army and bother the pains in the butt like we are.
Well, and that's what we try to do. And because you hit it right on the head, people are no doesn't mean no. No means I'm not ready. Now is not the time. I learned that in sales training. When someone tells you no, it means it's not doesn't mean no. It says I'm not ready. I need more information.
Hmm.
That's what it means. And so we try to bring the information. I will tell you, and I'm very proud of this, is that I think we've of those that have actually posted, they three so far that got the vaccination after watching one of our guests present. One of them is Roxanne is on here tonight. I know I'm not sure who else is on, but we've had three so far. And that was I was always very upset and irritated about the state's strategy rather than educate and inform and give the people an opportunity or a venue where they could learn about the benefits of a vaccine. Really, what is it? No, they went the route of bribery. They went the route of come sign up for free trips to Vegas or free Zippies or free McDonald's
Yeah.
and that I mean that's not what I want to hear. I don't want to hear. I'm on the fence. A
Yeah.
freaking trip to Vegas after you told me no fly to Vegas
Yeah.
is not what is going to make me change my
Oh,
mind. And
no, I
my
yeah.
daughter, and this is true story. My daughter, when we first started months and months ago trying to get my kids to vaccinate, my daughter said she was ready to get the vaccine in Oregon, and then the state came out with this bribery campaign about this lottery that if you got the shot, you would get entered into a lottery and she said something doesn't sound right, and she changed her mind. And
Yeah.
we never did that. This state never did that. You know, they put out the highly technical crap that people don't really understand. But
Yeah.
then it was all about bribery, and then now it's even worse. They're basically talking down to the unvaccinated,
Yeah.
right? And saying basically putting the blame on the unvaccinated, and now you're creating people that are pissed off
Yeah.
and they're gonna dig their feet in the sand and they're gonna fight back
Yeah.
rather than hey, we're in Hawaii, people. We're the Aloha Spirit. Aloha Spirit is not, hey, we're not going to reward or punish the vaccinated people because of the unvaccinated people. Brother, that's the wrong way. That's not Hawaii. That's not
I
local,
know.
and
Yeah.
and it's pissing people off. And rather than just say, hey,
It's
set up some
conflicting
informational
messages.
things.
Yeah, and I think that for because we're family medicine, so primary care it's like we're the delayed gratification people. So we're the people like I mean some days I wish I stayed in surgery because I immediately fix something and you guys are happy with us, but for us we're the delayed we spend a lot of time trying to get people to change behaviors. And so I think one of the big things we know is that message matters. And like if I just change a few words, I can lose a bunch of people. And I think, so one of the things is for Hawaiian Health, I was in Native Hawaiian Health for years. And that was the common thing was they would just incentivize everything. And I think that it's appropriate sometimes to give people I would say I wouldn't use it as a carrot, but really just help them value something. But like the fear one, the fear message, the bribery message, and then but what really seems to be effective was getting people that they trust to talk to them like an adult or like a real person and just let them know that they're meaning that as a person, no matter who you are or what you look like, you matter enough for me to give you time and education and then help you make a reasonable decision with the right information. And that usually works. I mean, it's just, it's just respecting people enough. And I think part of the problem, and this is a nationwide thing, was they cut the physicians out of all of this. So,
Mhm.
most of the time when you look at UK, they actually they got all of the primary care docs and they kind of just mobilize them because you have a relationship, they have a vested interest, they have the expertise, and they're going to take the time. But here, I mean, I have physicians here, they have the relationship, they have the trust, but they have no access to vaccines, they have no support. And so, it's just kind of like we're missing out on a big pocket of people, and their people are vocally anti-vax not because they're dumb, or because they don't like life, but because they're being treated very like condescendingly and giving
Oh,
contradictory messages. And I'm like, these are reasonable people, please stop doing like.
absolutely. You know, and again, and because again, human nature causes you to go
Yeah,
into defense mode, to go into fight mode, and you know what? Why are we doing that? Why are we creating that division? Well, we all should be one big ohana. We should all be helping each other, whether you vaccinated or not. I mean, come
yeah,
on. And the government, you cannot sit back and put all the responsibility on people getting. If that's your only strategy, you're gonna lose.
yeah,
Well, if that's your only strategy, we're gonna lose, and this virus is gonna win. And and you know we've been saying this for a long time, but they don't listen to us. I mean, you know, I know they watch them
come
after we
by.
all go. Yeah, they're gonna watch them later, but they get pissed off, right? Then they get defensive again, and they say
Yep.
stupid things, and because they
Mhm.
cannot handle the truth, they cannot. You know, this is not something only Mel and Charlie and our guests are saying. This is what everybody's saying. It's so interesting when I watch the spotlight because our show is our viewers, right? And we get some
Mhm.
people that disagree with us, but they're on and they're professional, and that's cool. Like I said, we like all dialogue. But when you watch the spotlight, Star Advertiser, that is made up of people from across the state,
Mhm.
not Mel and Charlie viewers, and the comments are the same as those of the Mel and Charlie show. So that tells me those people are not influenced by the Mel and Charlie show. It's not just the Mel and Charlie show and our viewers that feel this way. It's across the state,
Yeah.
and they still don't get it. They still don't get it. So
Hmm.
what you gonna do? What you gonna do? We gotta keep spreading the message. And
Keeping
like I
away.
said, if we can get one or two people to change their mind, or I shouldn't say change their mind, but get the information that they need to make a responsible decision, then we've done our job. And if the information we provided uh, convinced them to not get the vaccinated, you know what? We did our job too. We provided them the info. They made their decision. That's sincere from my heart, and I don't think of anybody less. Now I get pissed off when people spill and vomit their garbage of misinformation out to convince people not to get the vaccine. Hey, you guys, shut your mouth. You
Yeah.
make your choice, but
Yeah.
don't go convince others not to get the vaccine. You know,
Yeah. I will fist fight people for that. Yeah. I agree. It's like,
yeah. You just, I mean, you want to take it, don't take it, but don't
yeah.
go protest and rally and say, hey, this thing is gonna kill you. The vaccine gonna kill you. I mean, Lord have mercy.
Yeah, I
And
mean, I think I had that talk with some Hawaiians about that, because then I just like, this is something like, in the past, we wouldn't have been, this would have been withheld from us. This is like, so, this is like, we have every right to be distrustful, and, but I was like, but at this point, we also have a right to live and to not suffer and to have all of the benefits of modern medicine that everybody else does. So I was like, but I think first is the education and support and the respect part. And that's hard for our government. So it's hard.
yeah, I, I mean, that's remember where we're at, right? We're in Hawaii, the aloha spirit. Just practice with aloha. Practice whatever you do it with aloha. And I don't know who this guy Johnny Race is, but he's not. I cannot tell if he's trying to be funny or what. But shut up and get your hush money. Like I
Sweet.
said,
I
yeah,
would
it's all
like,
right. It's all cool. It's all groovy. It's all groovy.
yeah.
Anyway, guys, any closing thoughts, Doc, before we sign off?
Oh, I mean, so let's see. So you guys got the top end of the island chain. I got the bottom end, and
Yeah,
Doc is in
the
the middle.
bookends. Yeah,
Yeah.
we're the
So
bookends.
we're I mean, out here. So I think my message has been consistent. It's that the safety net, like, the reason why we're so passionate about it is because the the burden of the disease isn't borne equally by everybody. And so I think, your end of the island, of the chain, our island, our end is, we bear it on the kind of disproportionately. So I think, just that's why we push so hard, because we don't have any wiggle room, and we cannot afford the gamble. And my mom still works at Safeway. My dad is a truck driver. Like those are the people that are going to get affected. And like Misco is saying, just it doesn't matter whose family it is. Somebody's family is getting affected, and we could prevent it. And I think that's why we are going to keep on making some good trouble as much as we can, because eventually enough of us will get critical mass. And I think just try to seek out good sources of information. And if you guys can talk to somebody else and try and get them some good information too, that's really helpful. I think just we have a lot more power than to make change than we feel. Yeah. Where your
One
mask?
one question, real quick. Janelle is asking, where can she get a Johnson & Johnson vaccine in Hilo?
In Hilo. So I mean, you can. We actually have that. I'm not sure of the other sites right now, but I know that statewide there was an issue with the supply. But we do have. So tomorrow, Hilo Lanes, I believe they will be there. Hilo Lanes, 9 to 1. They're 9 to 2. I'm 9 to 1. I'm in Kona, so I'll be in Kona, but you'll see my team. So just look. Dean Ishioka and my awesome RNs are out there, and yeah, they have Johnson & Johnson.
At Hilo Lanes?
Hilo Lanes, the former Hilo Lanes, yes, and you'll see, I believe, some retired policemen helping us, and my
All
happy.
right. There you go.
Yeah. But they get all three too, if you guys like.
All right. Well, Doc, thank you so much for
Yeah,
sneaking
nice
up.
to see you.
I had to go look down if there was a third one, but no, it's just
No,
you, so we're all good.
I'll see
Awesome,
you
awesome.
tomorrow.
Well, thank you guys so much for joining us again tomorrow night, 6 o'clock, guys. We got my son and my daughter. You got to hear my daughter's story. Those of you on the fence, check it out. And again, you make the decision. All right, guys. We'll see you guys tomorrow night. Aloha.